Insulin is a hormone produced in the pancreas. Among others, it controls the amount of glucose in the body by absorbing it into the cells. When the pancreas stops producing insulin or produces too little of it, or the insulin produced cannot work as it should, this is when diabetes occurs. Insulin substitution is the foundation of treatment for people with type 1 diabetes and people with type 2 diabetes whose treatment with other medication is not successful. For type 1 patients, insulin is essential for survival. Insulin is injected into the subcutaneous tissue, and there are animal, human, and synthetic man-made forms. There are many types of insulin. Apart from their forms, the main differences between insulin types is the speed at which they reach the bloodstream, the effectiveness in helping the absorption of glucose in the body cells, and how long they last. Insulin can be broken down into different groups based on their activity profiles. Basal insulin, which is longer-acting insulin, and bolus or correction insulin, which is shorter-acting insulin. These profiles show the duration of insulin activity in the body and is usually given in hours. The basal insulin is responsible for supplying the physiological insulin requirement, and the bolus insulin for covering carbohydrates that increase glucose levels during a meal and for correcting high glucose levels. Basal insulin is usually injected once or twice a day. The body is steadily releasing glucose from its stores into the blood, so our cells are supplied with energy to keep up with basic body functions. This release is slow and comes, for example, from the liver, which stores glucose. The basal insulin covers the physiological requirements and forms the foundation for successful additional insulin management with bolus insulin. Bolus insulin is used when the glucose level is in the high range, or when carbohydrates are consumed during a meal that increase the glucose level. Here, bolus insulin is injected before a meal to cover the rising glucose levels. There are two types of bolus insulin by the speed of action: rapid-acting and regular, short-acting. Rapid-acting and long-acting insulins are also used in combination as an insulin mixture with different percentages. These mixed insulins are usually injected twice a day and are linked to a fixed meal plan. That is why they are particularly suitable for people with a regular daily routine, but do not allow for flexibility. For the optimal treatment of diabetes disease, a well-balanced interaction of all measures is necessary. It's therefore important to closely coordinate insulin management, nutrition, exercise, and the testing of glucose levels. For type 2 diabetes, oral or non-oral medications may be prescribed, such as metformin or other hormones, and possibly insulin if the medication is not successful. Very often, certain medications and insulin are combined in therapy to address insulin resistance, an essential compound of type 2 diabetes. For type 1 patients, insulin substitution is required for life, and insulin is commonly injected by insulin pen, but can also be delivered by an insulin pump, which continuously infuses insulin via a cannula under the skin through the day and night. Since the glucose level is in motion 24 hours a day and can be strongly influenced by nutrition, exercise, the amount of delivered insulin, and many other situations, detailed training for the patient and close consultation with the diabetes team is necessary for the implementation of insulin therapy. An adequate and individual insulin supply is important to keep the glucose level in balance. The goal of glucose control is to come as close as possible to an individual defined target range, which may vary depending on the type of diabetes complications present. These target ranges may also differ by country. The guidelines in the respective country will provide information on this. Management of diabetes requires constant monitoring of glucose levels, which can be done through a finger prick and testing of the blood with a disposable test strip and lancing device. Alternatively, people with diabetes choose RT-CGM devices, which may reduce the need to finger prick on a regular basis, or in the case of Dexcom G6 or G7 sensors, reduce it to 0 when general requirements are met. This technology allows patients with diabetes to monitor their glucose readings on a device like a compatible mobile phone or a separate receiver. These methods allow you to then adapt at all times to the circumstances and medication that impact your glucose levels to ensure they stay in the target range as much as possible. For every person with diabetes, treatment will vary. At Dexcom, we are passionate about empowering people with diabetes to manage the disease and improve clinical outcomes and quality of life.